is Dr. Samir Islam. I want to thank you for joining me tonight. So tonight's a very interesting topic. This actually comes from a patient who actually asked me, doc, I have these different colored poops. My poop is floating, sometimes it's green. What does that mean? So that led me to think about, I don't know if a lot of people really understand what it means whenever you have different types of poop, whether it's different colors, different shapes. So tonight, I wanted to discuss what does the different types of poops mean, what you can get whenever you look at your poop and you're thinking, this looks a little bit different, a little bit from the norm, and hopefully I can give you some guidance for that. And so when it comes to poop, a lot of people don't look at your poop, and that's fine. If you don't care about what your poop looks like, that's perfectly fine. I think you'll do okay. But I do think it is important to have an idea of exactly what's coming out from your bottom, whether it's a different color, shape, or texture, because this could determine a couple different things. Number one, what is going on in your body. Also, number two, whether you may have a problem in the future with respect to problems with something going on in the gut or the GI tract as well. And so it's important to realize that. Keep in mind, the most important thing is that anytime you see something that's a little bit different, whether it's a new symptom, a color that's consistent, or a shape that's consistent as well, make sure you speak to your healthcare provider about what that could be, because that could mean further testing needs to be done. So the next couple of minutes, I'm going to talk about different colors of poop, shapes, consistencies. I'm hoping this will be a fun conversation to have to give you more information about what the different shapes and types of poop may mean. So the first one's yellow. What is a yellow poop and what does that mean? For people who have a yellow poop, this can be due to any number of different reasons, whether it's problems with having foods that are high in certain types of food that you eat, whether it's sweet potatoes, carrots, turmeric, or even yellow food coloring. People forget there's a lot of yellow food coloring that people have, and that can cause people to have yellow poop as well. Sometimes a yellow poop can also be a sign of intestinal infection, a recent intestinal infection within the gut that could be causing your stool to be turning yellow as well. For some people who have acid reflux or we take acid reflux medications, that yellow poop can also be a sign of just a consequence of that medication that you're on. But the most common reason, though, is excess fat in the stool, and this can be due to a lot of different reasons. This condition is called diarrhea. Usually when people have excess fat, it's difficult to flush, it can smell, it can be very oily, and you may see some stains on there as well. And this excess fat can be due to any number of medical conditions, whether it's a condition called celiac disease. If you have any questions about that, refer to my video on celiac disease, or any disorders of the liver, pancreas, gallbladder, and these are organs which are typically used to help metabolize fat to get rid of that. And so this is what yellow stool could mean. Green stool, which is obviously a different color, can be due to actually eating a lot of leafy vegetables. When you have a lot of broccoli, lettuce, stuff that's green, that can make your stool turn green. If you eat green, green will come out. Obviously, if you have something that has a green color to it, or a food coloring that's green, it may come back as green. Sometimes iron supplements can cause you to have green stools as well. Green can also be a sign of a increased speed in the intestinal activity, meaning that your gut may be moving things faster than what it normally does as well. Or if you have a recent change in your diet, let's say you're going from a very unhealthy diet to a healthy diet, that may manifest as well in green stools. Typically not anything to worry about or anything that we're concerned about. Stool that sinks very quickly. This may mean that you're not getting enough fiber or fluid in your diet. Maybe you need to increase the amount of fiber or drink more water to make sure your stools don't sink all the way to the bottom. And also, it may sink because of the fact that your intestines stay in longer than what it normally does as well. This is the opposite of floating stool. Occasionally, having the floating stool is nothing to worry about. And if you notice it's floating up to the surface, not a big deal. This happens sometimes. But this can be due to excess gas that mixes in the stool, either from carbonation or beans or even sugary foods. And there is a medical condition called IBS, or irritable bowel syndrome, that can cause stools to float as well. And this also can be a consequence of not absorbing fat properly. Things like we talked about before, whether it's celiac disease or a problem with the gallbladder or liver or the pancreas. And so keep in mind, if you have consistently floating stools, this may be something you want to speak to your healthcare provider about, but whether this needs to be addressed further on. Now, sometimes you can have small, very pebbly type stools as well, almost like pellet type stools. And this is a stool that comes out in small pieces rather than a long smooth stool. This can be due to a lack of fiber. Fiber helps hold the stool together to keep it one long form. If you don't have enough fiber or have enough water, that may cause your stools to become very small, pellet-like, and difficult to pass. And so upping your fiber intake may help up to 25 or 30 grams per day. I do warn you, if you do this, make sure you do it on a slowly scale, because too much fiber at too quickly of a time can cause symptoms of bloating, distension, and abdominal pain as well. Certain foods have fiber which you can supplement, including brown rice, quinoa, flax seeds, beans, and pears as well. Having loose stools can also be a sign of a recent change in your diet. If obviously you change your diet from one particular food group to another, this may mean that you have loose stools as well. This could also be a problem from excess fructose. Fructose is a certain sugar or carbohydrate that's in a lot of foods, especially in high fructose corn syrup, and a lot of supplements that have high fructose can cause you to have looser stools as well. Also, loose stools can be a sign of a GI infection within your gut, so make sure if you have this on a consistent basis, or if you have this with fevers, chills, and pain, speak to your healthcare provider about whether this needs to be addressed. If you're having even infrequent stools, which can be defined as constipation, typically this is less than 3 times per week, this may be a sign of a GI problem as well. There are a lot of medications that can cause constipation, whether it's iron supplements or certain blood pressure medications that can cause constipation. And obviously a common dietary problem for this is lack of fiber. If you don't have enough fiber, this can cause you to be constipated as well. However, the thing that we're worried about is that this can be a sign of something growing inside your abdomen. If you notice you're having more infrequent stools for greater than 2 weeks, or your stools change rapidly and does not become to what it was before, if you have associated nausea or vomiting or significant pain in your abdomen, this could be a sign of something going on within your gut that needs to be evaluated by a professional. So if you have these symptoms that are occurring long term with these other associated symptoms, make sure you speak to your healthcare provider about whether you need to get further investigation about what's going on. Mucus in the stool can be very normal. I have a lot of people come ask me, I noticed something mucus in my stool. Is this normal or not? And for a lot of people it is. This would be very common in conditions like IBS or irritable bowel syndrome as well. In some instances though, this may be a sign of underlying inflammation or irritation going on in the gut that may need to get further investigation. But in most cases, it can be normal, especially if it's a small amount. If you have pencil-thin stools, this may be associated with excessive straining. Whenever you have to push very, very hard, there may be a sign of, or this may be a consequence of pushing very, very hard. However, consistently thin stools could signal a medical problem, including what's called an obstruction or a narrowing within the gut. Obstructions are due for a lot of different reasons. For some people, it could be due to a very large colon polyp, or sometimes it could be very large hemorrhoids. Obviously, the worst case scenario that we worry about when you have pencil-thin stools is something like colon cancer or rectal cancer. And so if you have this problem on a consistent basis, make sure you speak to your healthcare provider and let them know, hey, my stools have become pencil-thin. I'm worried about something going on within the gut. And certainly your healthcare provider can refer you to a gastroenterologist to get further investigation for what exactly is going on. When you have pale stools, this could be a sign of a lack of bile in the stool as well. And this could be due to undigested fat. So keep in mind you may have other associated conditions, whether it's shiny or greasy stools, floating stools, or foul-smelling stools as well. Certain medications may cause your stools to become pale, so make sure you're not taking these medications, including Pepto-Bismol, kaopeptate, and anti-diarrhea medications as well. Common complaint is undigested food. There are a lot of people who come to see me who say that they see their undigested food within their gut and they're wondering what's going on. There are a lot of plant-based foods that are not easily digested within our GI tract that just pass on through our gut and end up in our stool. Things like corn and grape skins, and this is because we lack the enzymes that are needed to digest those particular foods. Eating more slowly and chewing each bite thoroughly can certainly help out with that problem as well, but know this may be a consequence of just the things that you eat. However, if you do see undigested food regularly with associated changes in your bowel habits like diarrhea or cramps, make sure you speak to your healthcare provider about what could be going on. There could be other conditions that need to be investigated to make sure that we're not missing anything within your gut. Bright blood per rectum is something that is seen and that I see patients for commonly. Foods can cause this, so keep in mind if you're eating these foods, this may be a consequence from that, whether it's beets, cranberries, tomato-based soups, or juices, or even red food coloring as well. However, the most concerning thing that we find is that you could be bleeding somewhere within your gut. And if you're seeing consistently bright red blood per rectum or bright red stools, this is never a normal thing to have. Make sure you speak to a healthcare provider about what symptoms you're having. This could be a sign from bleeding within your gut, either from what's called an AVM or an arterial venous malformation. Could be due to a hemorrhoid. Could be due to an anal fissure, which is a tear within the rectum. Could be due to a condition called ulcerative colitis, diverticulosis, and obviously the worst case scenario that we worry about is colon cancer. So the most important thing I tell my patients is that bleeding is never normal. If you have bleeding in your stool, do not just assume it's just a hemorrhoid and be done with it. Make sure you speak to your healthcare provider about what's going on, and make sure that you don't just ignore this particular symptom. So black or dark stools typically can be due to certain things that we eat, whether it's food, supplements, or medications. Pepto-Bismol is a very common cause for black stools, so make sure that if you're having black stools, you're not taking Pepto-Bismol as the cause for this. Kaopectate can cause this. Taking iron supplementation. If you take activated charcoal supplement, this can cause your stools to become black as well. Now, what we worry about is when these stools become black and also tarry as well. This could be a sign of bleeding within the upper gastrointestinal tract, whether it's an ulcer in your stomach or your small intestine. And so if you have black tarry stools, this is something never to ignore. This may mean you could be bleeding, and this needs to be investigated immediately. So make sure you speak to your healthcare provider if you notice black tarry stools or you're worried that you may be developing an ulcer as well. So a lot of people ask me, what is normal? There's not a really good answer for that. This can depend on what you eat, what you drink, what stresses you're going through, and what your general health condition is as well. However, I will tell you that stool should leave the body with very little straining or discomfort, have a toothpaste-like consistency, and more look like a banana or a pencil. You shouldn't seek mucus or blood on a consistent basis. If you notice that your stool is bright, if you notice that your stool is black, if it's consistently pale, or if you have a change in bowel habits for it to be consistently thin or pencil-like, loose or watery, or accompanied by mucus or pus with abdominal pain, make sure you speak to your healthcare provider. This is never a normal thing to have, and if you have this on a consistent basis, you may need to get further investigation to see exactly what is going on.